In this video, we will learn following things about depression, general terms to depressive disorders, pathophysiology, drug-induced depression causes, screening tools, non-pharmacological therapy, psychotherapy treatment for depression, anti-depressant classification, withdrawal symptoms, meditative and physical treatment for depression, special populations, pregnancy and breastfeeding. Following are the general terms to depressive disorders: major depressive disorder (MDD), persistent depressive disorder, disruptive mood dysregulation disorder, premenstrual dysphonic disorder, substance-induced mood disorder, specified depressive disorder, unspecified depressive disorder. Patients who fall under the definition of major depressive disorder are the patients who must present with more than 4 of the following during the same 2 weeks period and with a change from previous functioning: depressed mood, least interest or pleasure, significant weight gain or weight loss, insomnia or hypersomnia, fatigue, feelings of worthlessness, less ability to concentrate, recurrent thoughts of death. Pathophysiology of depression: in genetics, social factor, and in female more than male. Next, changes in neurotransmitter, like monoamines, GABA and glutaminergic neurotransmitter, impaired circadian rhythm or HPA functioning. HPA equals hypothalamic pituitary action. Drug-induced causes of depression: corticosteroids, lowers body's serotonin level. Beta blockers, cause non-cardiac effects like fatigue, sexual dysfunction, depression. Drug-induced causes of depression: sex hormones, changes in hormonal levels, anti-Parkinson drugs, may cause depression due to long exposure to dopamine levels. Drug-induced causes of depression: proton pump inhibitors and H2 receptors antagonist. Central nervous system can be altered by changes in the stomach's pH. Anticonvulsants affect chemical messengers, neurotransmitters in the brain. Screening tools: in this slide we will learn the difference between screening and diagnosis. Screening: questioning or filling questionnaire, done by pharmacist. Diagnosis: testing to find out the problem or cause of problem, done by physician. Screening tools of depression: patient health questionnaire, PHQ-9, Hamilton Depression Rating Scale, HAM-D7, Edinburgh Postnatal Depression Scale, EPDS, pregnant females, postpartum depression, mood disorder questionnaire, MDQ, differentiate unipolar from bipolar depression. Screening tools list for clinicians rated and patient rated. Following are some non-pharmacological therapies: first, psychotherapy; second, regular physical exercise; third, light therapy; and fourth, motivational interviewing. Following are some psychotherapy types: cognitive behavioral therapy, interpersonal therapy, motivational interviewing, and others. Other pharmacotherapy methods: BA, behavioral activation; MBCT, mindfulness-based cognitive therapy; CBASP, characteristics of the optimal cognitive behavioral analysis system of psychotherapy; Pacific Standard Time, problem-solving therapy; STPP, short-term psychodynamic psychotherapy; Pacific Daylight Time, photodynamic therapy; ACT, VP, video conference psychotherapy. Cognitive behavioral therapy is when you have therapist who challenges your negative thoughts. Interpersonal therapy is when therapist looks within your family and friends. Motivational interviewing, to help patient to do good habits for themselves, like smoking cessation. Psychotherapy treatment for depression: first-line treatment, CBT, IPT, BA; second-line treatment, MBCT, CBASP, PST, STPP, telephone CBT, IPT; third-line treatment, PDT, ACT, VP, MI. All of these terms are explained before under the heading of other pharmacotherapy methods. Antidepressants classification, according to mechanism of action: SSRI, selective serotonin reuptake inhibitors, citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, sertraline. Antidepressants classification. According to mechanism of action, SNRI, Serotonin-Norepinephrine Reuptake inhibitors, venlafaxine, desvenlafaxine, duloxetine, levomilnacipran, dual-action antidepressants, BUPROPION, MIRTAZAPINE. Antidepressants classification. According to mechanism of action, other serotonin modulators, TRAZODONE, VORTIOXETINE, vilazodone, monoamine oxidase inhibitors, moclobamide, phenelzine, tranylcypromine. Antidepressants classification. According to mechanism of action, tricyclic antidepressants, amitriptyline, clomipramine, desipramine, doxepin, imipramine, nortriptyline, trimipramine. Antidepressants classification. According to mechanism of action, antipsychotics, aripiprazole, brexpiprazole, olanzapine, quetiapine XR, natural health product, St. John's wort, omega-3, vitamin D, folic acid, L-methylfolate. Antidepressants classification. According to treatment line, first line of treatment, bupropion, paroxetine, citalopram, sertraline, duloxetine, venlafaxine, desvenlafaxine, VORTIOXETINE, escitalopram, fluoxamine, fluoxetine best, mirtazapine. Antidepressants classification. According to treatment line, second line of treatment, levomilnacipran, moclobamide, quetiapine, trazodone, tricyclic antidepressants, vilazodone. Antidepressants classification. According to treatment line, third line of treatment, phenelzine, tranacipramine. Why fluoxetine is best among first-line treatment agents, longer half-life, least or no withdrawal symptoms, safe for pregnant or breastfeeding mothers. SSRIs Selective Serotonin Reuptake inhibitors, mechanism of action, SSRI binds serotonin reuptake transporter, prevent serotonin, 5-HT, reuptake, result in high levels of 5-HT in synapse, increase stimulation of postsynaptic receptors. SSRI Selective Serotonin Reuptake inhibitors, comments on drugs, citalopram and escitalopram, greatest risk of QTc prolongation, sertraline, taking sertraline with food improves 30% food absorption, least drug interaction. SSRI Selective Serotonin Reuptake inhibitors, comments on drugs, fluoxetine, best choice than sertraline, can be used in children, adolescents and pregnancy. SSRIs, time to onset of clinical effects, 2-4 weeks. Adverse effects of SSRIs, nausea, insomnia, sexual dysfunction, drowsiness. Adverse effects of SSRIs, sweating, xerostomia, sialorrhea. SNRIs, Serotonin-Norepinephrine Reuptake inhibitors, mechanism of action, prevent reuptake of 5-HT and norepinephrine, result in increased neurotransmitter activity at synapses and postsynaptic receptors. SNRIs, Serotonin-Norepinephrine Reuptake inhibitors, comments on drugs, SNRIs, time to onset of clinical effects, 2 to 4 weeks. Venlafaxine, it has inhibitory effects on 5-HT reuptake at all therapeutic doses, but more than 150 mg inhibits reuptake. SNRIs, Serotonin-Norepinephrine Reuptake inhibitors, comments on drugs, desvenlafaxine, active metabolite of venlafaxine, it has efficacy in peri-postmenopausal women. Duloxetine, used in person having fibromyalgia and nerve pain. Levomilnacipran, have greater anti-activity than 5-HT. Adverse effects of SNRIs, drowsiness, nausea, insomnia, increased heart rate and hyperhidrosis. Dual-action antidepressants, mechanism of actions, bupropion, inhibits reuptake of NE and dopamine, mirtazapine, increases central noradrenergic and serotonergic activity. Dual-action antidepressants, comments on drugs, bupropion, indicated or drug of choice for smoking cessation, indicated or drug of choice for sexual dysfunction, Contraindicated in patients at increased risk of seizures. Contraindicated in patients undergo alcohol withdrawal. Don't cause weight gain. Dual-action antidepressants. Comments on drugs. MIRTAZAPINE. Indicated for insomnia treatment. It has no active metabolite. Low rates of gastrointestinal and sexual effects. Causes weight gain. Adverse effects of BUPROPION. Nausea, insomnia, dry mouth, agitation, sexual dysfunction, weight loss. Adverse effects of MIRTAZAPINE. Weight gain, sedation. Other serotonin modulator. Mechanism of action. TRAZODONE, serotonin receptor antagonist. VORTIOXETINE, direct serotonin receptor modulation and SERT inhibition. TRAZODONE, serotonin reuptake inhibitor and partial serotonin agonist. Other serotonin modulator. Comments on drugs. TRAZODONE, prescribed as a hypnotic. TRAZODONE, should be taken with food. VORTIOXETINE, metabolized by liver. Adverse effects of TRAZODONE. Nausea, sedation, priapism means painful erection of penis, orthostatic hypotension, dry mouth. Adverse effects of TRAZODONE. Nausea, diarrhea, headaches, insomnia. Adverse effects of VORTIOXETINE. Nausea, sexual dysfunction, sleep disturbance, constipation. Tricyclic antidepressants. Mechanism of action. Interact with multiple neurotransmitter and receptors. Effect on mood involves inhibition of norepinephrine and serotonin receptors. Adverse effects of TCAS. Delirium, weight gain, orthostatic hypotension, sedation, migraine, neuralgia. Monoamine oxidase inhibitors. Mechanism of action. Moclobamide, reversible and selective MOA inhibitor. Phenelzyme, tranylcypromine, never preferred, due to dietary restriction. Irreversible MOA inhibitor. Adverse effects of MOAIs. Insomnia, edema, postural hypotension, dizziness, sexual dysfunction. Antipsychotics. Mechanism of action. Show activity at multiple dopaminergic receptors. Show activity at multiple serotonergic receptor. Adverse effects of antipsychotics. Olanzapine. Increase risk diabetes, dyslipidemia, extrapyramidal symptoms. Adverse effects of antipsychotics. Quetiapine. Increase risk of cataract, decrease thyroid levels. Withdrawal symptoms. If we don't taper off slowly, then patient may experience following symptoms like flu-like symptoms, sweating, tremors. Withdrawal symptoms, like vomiting, tremors, sleep disturbance, vertigo. Meditative and physical treatment for depression. Mild to moderate depression. First-line therapy, exercise. Second-line therapy, light therapy, yoga. Third-line therapy, acupuncture. Moderate to severe depression. Second-line therapy, exercise. Third-line therapy, sleep deprivation. Seasonal, winter depression. First-line therapy, light therapy. Natural health products. L-methylfolate, omega-3, vitamin D, folic acid, St. John's wort. First line for mild to moderate depression. Depression treatment for special population. Pregnancy. First line of choice psychotherapy. Prefer citalopram or sertraline or fluoxetine. Avoid paroxetine. Depression treatment for special population. Breastfeeding. Prefer citalopram, sertraline, escitalopram. Learn terminologies with MJM.